Hey there. Thanks so much for joining us for the Life Support Podcast. It's where we talk to providers, community members, experts, and others about their experiences with health and the systems that create it. Today I'm talking with Camille Evans. She's the Director of Behavioral Health at Valor Health, a critical access hospital in Emmett, Idaho. About 3 years ago, Camille began working with CWHO in a partnership to increase access to affirming and appropriate care for LGBTQ plus individuals living in rural communities. She talks a little bit about her lived experience as a family member of someone who identifies as LGBTQ plus and her professional experience and someone who ultimately has come to really be a strong leader within the community for developing more affirming care practices and standing up the healthcare system as a leader for affirming and appropriate care. Thank you to Camille for her openness and her effort in this area, and thank you to you for taking the time to listen. Enjoy. Well, Camille, can you tell me just a little bit more about yourself and the community where you live?
Sure. So I am an LCSW, and I'm married. I have 5 kids. I live here in Emmett. I've been here for about 21 years, but in Idaho pretty much my entire life. So Emmett is a town that's about 30 miles outside of Boise and is in Gem County, where we have just under 18,000 people. It, like all other areas of Idaho, is growing really quickly. It's a pretty conservative area. Idaho in general kind of is pretty conservative, but these rural areas tend to be even more so. So that's kind of a little bit about Emmett.
Awesome. And what do you do in Emmett? What's your job besides being a community member and a mom and a wife? What's your day job? Plus some.
So I work at Valor Health, which is a small health system. Includes a critical access hospital, an emergency department, a surgery center, primary care, and specialty care clinics. And so it's owned by the county, doesn't receive any funding from the county, but has been the hospital for, I think 60 years or more, has changed names multiple times throughout that period of time, but is the primary provider here in the Emmett community. And what I do here is, I started with Valor about 5 years ago. I started doing case management, discharge planning, utilization review, and I was the first full-time social worker that the organization had. So in a small organization, we wear lots of different hats, and so that definitely was the case. And I still wear a few hats, but I wear a few less hats than I did before. About 3 years ago, I started the process of developing an integrated behavioral health program in the primary care clinic. And so that's what I do for the most part now. Still support the social work program, which now consists of myself and one other social worker that works in the hospital. And so I provide some supervision for her, but spend most of my day doing behavioral health here in the primary care clinic.
Awesome. So that means that you're on meetings all the time, leading new initiatives, and then also getting your door knocked on to go see patients, right?
Yeah, it's juggling a lot of different things. I have a tendency to get myself involved in many different projects, and which is good sometimes, and sometimes feel very pulled in lots of directions. But I like the opportunity to develop new things. In a small organization, have a lot more freedom for innovation and just kind of like, let's try something new and see what happens. And that has been a really good and exciting thing for me.
That's awesome. Well, it sounds like what we do here at CWHO. So maybe that's why you're working with us like 15 hours a week just on shared projects. So we love it. But speaking of shared projects, I know a couple of years ago, we started working on the Pride in Idaho Care Neighborhoods project together. Can you talk a little bit about on your side how that came to be and really what your inspiration or purpose is behind that project?
Sure. So my interest in working with the LGBTQ plus population really kind of started about 10 years ago. with my oldest daughter who identifies as queer and struggled in this community to find support, find resources, just feel like she had a place here. And our home became a place where kids who were exploring identity and identified within that population felt safe. And so I got to know a lot of her friends and kind of kids along the way. And then when I came into this role, just saw that there wasn't any resources. The way we actually kind of got everything up and going was just a lunch conversation with Gen Y and her saying, hey, there's some grants that we'd like to go after to increase the awareness, the inclusivity, and support for the LGBTQ plus population. Would you be interested? Knowing kind of some of my history, and kind of went from there. And so have had the opportunity to build some of those programs.
Great. And so how did that really start out for you in terms of your vision for what you wanted to do at Valor with some of the grant funding?
So I knew that we needed to start with some of the basics, and that included providing education, just some awareness, some education on my part. Like, even though I had some exposure and knew a little bit, I knew I had a whole lot more to learn and continue to have a lot to learn. And then just some of the basic things like our forms, and just knowing that when someone comes into the clinic or the hospital, that we have some mechanisms to help staff be able to provide more affirmative care, kind of regardless of where they're at in their desire to do so, but that we just kind of have that stuff built in, and then we start to change the culture.
Yeah. And I know that, when we've kind of walked side by side on a lot of this work, that we were pretty surprised sometimes when we did a deeper dive into people's perceptions as consumers of healthcare in rural areas, and then also the views and skills of providers in rural areas. What to you stands out as the most kind of surprising or interesting things that you learned early in the process that we really decided that we needed to focus on?
Like you mentioned, in the beginning, I got a lot of, I don't really know why this is something that we need to put a lot of effort into. It really doesn't apply to very many of our patients, which I knew to not be true because I knew a number of people in the community that it did apply to. But as we've created a more inclusive, safe environment, then people are feeling like they do feel safe to tell us more about who they are and share those things. And it does apply to a great number of our patients. So that was kind of surprising that people really thought that it didn't apply. And then the mentality that it shouldn't matter, that I just treat all of my patients the same. And so it really shouldn't matter what their gender identity or sexual orientation is. That doesn't change the way I provide care. And in some cases, maybe that's true. But the reality and what I've learned as I continue to do this work is that the not recognizing that that's a huge part of who they are does make a huge difference in the ability to just kind of take care of the whole person and recognize who they are and what their needs might be, not to mention some specific needs that might be there for a patient who's transgender. And so I think that mentality is shifting, and people are now seeing more of the why as to why we need to do this work. But that was kind of something that I was surprised by. And then just the level of microaggressions that happen that you just are not even aware of. And the more that I've learned and you kind of see things, the more that I have been able to recognize those. And then on the kind of more positive side, the number of staff members that once I started to talk about this and put some things out there that have came to me and said, I want to be part of helping do this work. This is really important to me also. And so it wasn't just people who kind of were like, I don't know that we need, that this should be a focus, but there's a lot of people who said, yes, thank you. Thank you for bringing this up and for trying to increase the care options for people.
That's exciting, and I think really speaks to the fact that this is something that is very necessary, not only in Emmett, but in a lot of communities. When you think about this work being done with Valor and with health systems, and particularly within the context of, we know that LGBTQ plus individuals living in rural communities do face larger barriers to care, but also while all rural communities are different, they also face, on average, more discrimination and less support than other areas. What do you think the role of a healthcare organization, especially in a small community, should be in supporting or leading some of this work?
I think that we have a responsibility within healthcare itself to make sure that we can competently care for every member of our community. So when they come to the facility, we have an obligation to do that. But I think in a larger sense within the community, because we are the primary healthcare provider, we are also one of the largest employers in the community, which for lots of health organizations in a small community, that may be the case. And we connect with so many different areas of the community that as we do this work and this becomes something that people start to recognize, that it starts to kind of make a transition in the rest of the community. I had a conversation with our EMS provider just recently and had a shared patient that identifies as transgender and was able to provide a little bit of education on appropriate terms to use and ways to respect and honor them. And then was able to say, hey, I'd love to come do a training for your staff if that's something that you would like done. And so we have an opportunity to share what we are doing with the rest of the community.
That's fantastic. And I know that just based on some of my rather limited experience, but time in the Emmett community, that Valor is really an anchor and a leader. So it's exciting to see y'all take on this work. When you've gone through this process, which is almost 2.5 years now, what are the things that you can look back on and say were really effective and that you would love to share out with other organizations or communities looking to do similar work?
So like specific things that we've done?
Yeah. What are some specific changes or strategies that we've implemented that you would say was really successful?
Okay, yeah. So I started with looking at the lists that are out there, different resources that go through all the things that an organization can do to create an inclusive environment. And some of them made sense for us, some of them just really didn't. And so I had to pick and choose what was going to make the biggest impact and be something that we really could achieve. There's things in a small community that are on those lists that are just going to be very difficult, like having representation on your board. If that community is invisible in your community and doesn't feel safe within your community, you're probably not going to get someone on the board, at least, not for a while until some additional work's been done. So starting where we could. And what we started with was paying attention to our forms and moving to change those forms to be more inclusive, working on our EMR and having a way to be able to identify in the patient's electronic chart their name, their pronouns, any of the gender identity, any of that stuff that is going to help us in being able to honor who that person is when they walk through our door. Education to staff, which I've learned is something you have to make sure is ongoing with turnover and just all the other things that staff have coming at them. It's something that you have to kind of do at least on an annual basis to be able to help make sure that everyone is on the same page, speaking the same language, using appropriate language. So just conversations, and then we've also worked on identifying areas for care that haven't been available in the community and trying to fill those gaps, such as hormone therapy, gender-affirming hormone therapy, and then being able to upskill providers to be able to provide to offer those services.
Yeah, and you all have done so much work in the last couple of years. I think it's really neat to kind of look back and reflect on where you started and what you've really built out. And then I guess the flip side to that coin is, what can you look back on and say, man, if I was going to do this somewhere else, or if I was going to teach somebody else how to do this, I would have done X differently or Y differently. Any thoughts on that?
I think making sure that education in small, little, ingestible bits is something that's really accessible. So I hate recording trainings, but I have resigned to the idea that that's just how you have to do it, because when you have staff, and some staff that work 24, work graveyard shift, and you've got staff that's working 24/7, to get them all into a training, it's just not realistic. Not to mention, going through a pandemic and physically not being able to bring people together. And so being creative about how you get education out there early and often would be something that I would do more of from the very beginning. And then making sure that administration not only is saying, yes, we support this work, but they really understand the why we need to support this work. Why does it make a difference? What's the impact that they might care about that you can help to communicate? And that's something, these are some of the things that I'm working on now, recognizing that if I had done some of that from the beginning, maybe it could have made a difference in a different way. But those would probably be the biggest things.
Yeah. And I remember us being about 9 months into the project, and then we went and surveyed the providers, and we're like, oh, that's surprising. We should have figured that out earlier. So knowing that this was a group effort, I think that there's definitely lessons learned, but on the whole, more successes that we can share with others through like the Pride in Idaho Care Neighborhood Roadmap or other resources like that. One of the things that we have been really scaling and presenting a lot lately is the consultation model with Full Circle. Can you talk a little bit more about that and really why that's something that's effective in a community like Emmett, and what the benefit is for your provider team?
Yeah, so this is really focused on expanding services and being able to provide the gender-affirming hormone therapy in our community. Currently, or prior to us doing this work, there's nobody who's providing those services, and so people would have to go, drive, which could take, about an hour to every time that they need to see a provider, and they were having to switch their primary care provider to a provider over in the Boise area. And so being able to offer those services here was something that we felt like was important. So at the beginning of these conversations, none of the physicians that we have had any experience with really providing any of that hormone treatment. And so we luckily have a physician who was very interested in it and wanted to learn more and very willing to work with me on this. And so she has been instrumental in being able to make this work. And what we've done is partner with Full Circle Health in being able to provide a consultative visit. So when we have a patient who comes in and says that they would like to start hormone therapy, then we do an initial visit with them, ask some of the initial questions, educate them on what this means and what the side effects are, and just to help make sure that they understand and we have informed consent that this is what they would like to do. And then we kind of continue that with the consultative visit where a provider from Full Circle Health will virtually meet with us and the patient and discuss any questions that they have, and really then focus on what is the appropriate plan of care for this patient, what medications would be used, at what doses, answer any questions. And this provides not only additional information for the patient, but education for our physician. And eventually, we probably won't need those consultative visits. She'll feel comfortable in being able to provide that, knowing that we still have Full Circle Health providers to call if there's questions that come up. But it's been a great way to bridge that gap that we have, and something that I can see other communities that maybe even have a longer distance that patients may need to go to access services that they could replicate and their community members could benefit from.
Yeah, I think that you guys have created a model practice that hopefully, again, could really support other organizations as well. I guess one closing thought for me is just thinking about that when we've done provider trainings, it's been great to go and do some of the really content didactic trainings, but what folks seem to really enjoy was hearing from patients that had both positive and negative experiences living as an LGBTQ plus community member in a rural area. So kind of in that spirit, are there any stories of patients or providers that you feel comfortable sharing that really stick out to you as kind of highlighting why this is important?
Yeah, I have one patient in particular that definitely just pops in my head, and I have asked him if I can share the story, and he said absolutely. So this patient, when he first came to us, was very anxious. Had initially we were kind of focused on some mental health needs, and then moved towards him being interested in hormone therapy. And so we did the consultative visit. We got them started on testosterone, and it had probably been about 6 months, I want to say, that they had been on the testosterone, and we've had to do a little bit of, back and forth, making sure that the dosage was right and stuff. But they said to me one day that they had always struggled to be able to look in the mirror and I mean, even just to look in the mirror for any extended period of time, because what they saw reflected back to them just did not feel like them. They couldn't connect with what they were seeing in the mirror, and it was really hard for them to just be able to stand there and look at themselves. And he said, I, the other day, stood in the mirror and just stood there for about 5 minutes just looking at myself, thinking that I feel more like me. I started to really like what I was seeing in the mirror. And the interesting thing to me is that if you were to look at this patient 6 months ago and look at them now, there's really no physical changes that you could identify, but just the way that they felt inside, the small things that they could start to see that helped them feel like they were becoming the person that they felt like was more genuinely who they are. And so that was really powerful, and a good portion of the anxiety and depression and stuff that they were dealing with has just kind of resolved. I mean, they still experience some, of course, and there's things that we're still working through, but just to see that transformation in them is definitely why do the work that we do.
Perfect. And as it should be, that response, which I think just highlights the importance of the work, brought up two other questions. One, feel free to decline this, but I think in the context of a lot of the politicization of healthcare for LGBTQ plus individuals, particularly those who are who identify as transgender, what do you feel like the role of healthcare should be, and how does it impact you as a healthcare provider in a more rural and conservative area when that legislation is potentially looming?
Yeah, I mean, personally, I feel like it should be a decision between a provider and a patient. Healthcare, I think we have a responsibility to make sure that that is being done in a ethical and safe way, and that that's not something legislation should be guiding. In just my experience in working with people, as some of this legislation has come forward, and there's been all of this discussion, and seeing the fear and the kind of trauma that creates for not only patients but parents. I have a minor that I work with, and the parents started making plans to figure out how they were going to move their entire family out of state. And that is such a hard thing to see a family have to consider, just to be able to protect their child. And they truly felt like this is what they needed to do to protect their child. Luckily, it has not come to that in this state, but I think that is something that continues to weigh on the hearts and minds of people who know the impacts that legislation like that could make.
Absolutely. I think it seems like we're seeing stories almost every day, or at least every legislative cycle every day, about families that are really living in fear. So I think for Valor to take the step to really be, again, affirming and provide care within people's own community is really, really important. So just want to acknowledge whether or not this gets included in the podcast, that's just amazing work that you guys have been doing.
Yeah, and kind of just wanted to jump in really quick, because when we talk about like the things that we've learned, it brings up one other thing. Because of the political stuff and just the environment that we're in, one of the things that I've learned is you not have to only equip staff members with the right language to use, and how to be respectful when someone comes into our clinic that identifies as LGBTQ, but also need to prepare them for people who may have a whole lot to say in a very negative manner about the fact that on our form it asks them their gender identity, and we're asking some of those questions. We've had some issue with patients then in the middle of the lobby voicing their disapproval of these things being even offered as part of healthcare. I think we just have to be aware of that. We have to give staff some things to be able to respond to the people who might act that way when they're confronted with it.
I think that, again, it's about supporting people where they are. And I feel like at some point it's inevitably going to end up being political in some ways, but it's just the personhood at the center of it. I think you do a really nice job of kind of spotlighting it's about taking care of people and making it a decision between a person and their healthcare provider. So I just appreciate the work that you guys are doing there. And I know we don't anticipate it going away in future legislative cycles. So just for those that might be listening to kind of think about that perspective. My last question, and talk a little bit about the intersection of behavioral health and LGBTQ plus care. That's something that I've been doing a little bit of learning on, kind of on this journey with you. And I know that that's an area where you really focus. And you talk a little bit more about that.
Yeah, for me, when I look at those gaps in our community, that was a huge gap. It still is a huge gap. There are very few mental health providers as it is. There's not enough to serve the community. And then there really isn't, to my knowledge, anyone who has any additional knowledge, let alone expertise in working with the LGBTQ plus population in the community. And I think that just like when we talked about that someone within that population, it's a part of who they are. And if we don't recognize that, we do a disservice to that individual. And that applies in healthcare and it applies in mental health. And so if, as a mental health provider, you're going to work with someone who identifies as LGBTQ or is questioning and is needing to explore that, because that's a huge part of what we might do in mental health and behavioral health, then you have to have some level of competence in being able to safely help someone walk through that and know some of the language. And so that is a huge part of the work I've done over the last 2.5 years is just trying to educate myself and find different trainings that are going to help me build those skills and gain more knowledge and in some places some comfort level in talking about things that I'd never really talked about before. And so that, I think, is a huge gap that we have. And I hope that I'm seeing more and more people become interested in learning more and providing services, but I think we have a lot of work to still do.
Well, thank you, Camille. That gets me to the end of my questions, and I think also the end of our time. Is there anything else that you want to say? Anything kind of as we get to the end of the conversation that you're like, oh, I wish I would have brought up X, Y, or Z?
I think the last thing I would just say is I've thought a lot about why I'm so passionate about working with this population. Yes, I have some personal connection because of children, but also what I have learned in working with people is that we are all trying to figure out who we are, and that's a scary thing to do, to put out there, this is who I am, and not know how it's going to be received. And when who you are is something that society is telling you in multiple ways is not acceptable, it takes such courage to say, no, this is who I am, and I am learning how to express that and find comfort in that, and then I'm amazed by the courage and the bravery that takes, and how much we can learn no matter how we identify, about that ability to show up and just say, this is who I am, and that level of vulnerability that it takes. And that, I think, is part of why I am drawn to working with this population.
That's really beautiful. Thank you so much, Camille. It's such a joy to work with you on this project, and super passionate about it. And I'm already writing up some articles, hoping that we can get more of this moving in the future.
Well, thank you. I very much appreciate working with you, and I look forward to continuing to do the work.
Thanks so much for listening. Please find us on social or our website to learn more about what CWHO does and how to support with and engage our work. Until next time, let's all support each other with a little life support.